Many patients who see us in clinic, despite their weight, remain free of illnesses. But there's another group of patients who, as a consequence of their weight, have become unwell and maybe have metabolic illnesses such as diabetes, high cholesterol, sleep apnea, fatty liver, or high blood pressure. And for that group of patients, they're not interested just in the weight loss they might achieve, but they want to know what benefits the surgery might have in terms of those illnesses, their long-term health, and living longer. And I need to reassure that group of patients right now that the surgery is really, really effective for those illnesses. And the evidence shows that not only will those illnesses be improved by surgery, but patients can also live longer too. It's so effective that in professional circles, we no longer really talk about weight loss surgery or bariatric surgery. We talk about metabolic surgery. And that's because the sleeve gastrectomy and the gastric bypass are so effective in terms of improving or leading to remission of illnesses such as diabetes, high blood pressure, fatty liver, and sleep apnea. Now, no one really knows quite how the gastric bypass and the sleeve gastrectomy have this effect on diabetes, but it is a very strong effect. In fact, it's remarkable. Sometimes I'll have patients come into hospital who've been diabetic for a number of years on multiple medications, and they'll leave hospital off medication with their diabetes in remission. And note, we talk about remission in the same way as we might talk about remission from cancer, because there is a chance in the future that the diabetes may return. And it's not just us surgeons who are telling the world how effective the surgery is for diabetes. It's also the medical associations, the British Diabetic Association, the physicians have come together, and they now recommend bariatric surgery for patients with poorly controlled diabetes. So if you are worried about your health, if you do suffer from diabetes, heart disease, high blood pressure, sleep apnea, fatty liver, then surgery could be a very good choice for you. And the next step would be to come and see one of my colleagues or myself in clinic to discuss it further.